I don't know if it was you or like someone who was translating you, but uh, you were talking about how the AI and precision medicine can really add 20 years to people's lives right now, not in the future, but what's available right now, which I think is an interesting concept. I think a lot of people
Mhm.
do. I think a lot of things are kind of like hype. Like there's nothing you really can do. You can like maybe measure it, maybe do some stuff. But I think we talked about some of the stuff that you already can do to actively change your life. If you delayed a neurodegenerative disorder by 10 years, that's massive, um, and huge. So what are some other things that you think can have a massive impact, like a 20-year regression or improvement?
For sure. So in Wild Health, which I mentioned, so what we do, and we've published now studies on the outcomes of this. Every patient we see, we sequence their genome. We look at about 700,000 specific genes. We do really big biomarker testing, like a massive panel. Pull in all the wearable data, do tons of questionnaires and phenotypic data. We take in these millions of data points, and then we built this AI platform to then be able to say, this is the perfect diet for you based on your DNA, the blood work, everything we have here. This is how we're going to optimize your exercise program. These are supplements that will work for you and which ones won't work for you. These are medications that will work and won't work for you. And what we found is that when you actually tailor someone's treatment to down to the level of their DNA and their epigenetics as well, their genetics and epigenetics, you can have phenomenal results. Like I mentioned, my mother in 3 months on that program, getting her the diet, exercise, and everything perfect for her. She lost 40 pounds, reversed her insulin resistance, said she felt 20 years younger. My co-founder's mom, we put him on the program. She lost 80 pounds, got off all of her chronic medications. And we've published on this now, like we talked about metabolic health and type 3 diabetes being dementia. When you look at type 2 diabetes, elevated hemoglobin A1C in traditional medicine, they reverse that about 3% of the time.